Your knees are gatekeepers of movement. Protect them, and your freedom to move lasts a lifetime. Caring for your body goes beyond looking good or lifting heavy. It is about preserving your physical, mental, and emotional well-being across decades. When one joint, like the knee, becomes compromised, it can ripple into your gait, posture, mobility, exercise consistency, mood, and quality of life. Your knees bear enormous loads. Your body weight, shock absorption, direction changes, and stabilizing forces during daily life and athletic activity. Therefore, choosing safe, joint-friendly exercises is a form of self-care. A balanced approach to movement helps you stay active, avoid injury, and age well, physically, mentally, and emotionally. In this article, script, we'll explore common risk factors to knee health, warning signs, safe exercise choices, ways to remediate issues, prevention strategies, scientific context, and consequences of neglect. The goal: help you move better, stronger, and safer for years. Many lifestyle and systemic factors weaken the support system around your knees. Understanding these helps you address root causes, not just symptoms. Poor nutrition and inadequate micronutrients, weak connective tissue, cartilage degeneration, poor healing capacity, all tied to deficits in protein, vitamins, e.g. vitamin D, C, minerals, magnesium, zinc, collagen precursors. Sedentary lifestyle, prolonged sitting, tight hip flexors, weak glutes, hamstrings, and calves. This imbalance increases stress on knees during movement. Excess body weight, obesity. Every extra pound increases joint load. Knees take a disproportionate share. Over time, wear and tear accelerates. Muscle imbalances or weakness, weak quadriceps, glutes, or hamstrings change movement mechanics, placing excessive stress on ligaments, menisci, or patellar tendons. Poor movement mechanics, alignment, knee valgus, inward collapse, hip adduction, foot pronation, weak core. These can funnel forces incorrectly through the knee joint. High impact, repetitive strain without recovery, running on hard surfaces, jump training, or repetitive deep squatting without strength and mobility support leads to micro damage. Inflammation, systemic disease, or joint degeneration. Chronic inflammation, from diet, stress, osteoarthritis, rheumatoid conditions degrade cartilage and joint health. Aging and degenerative changes, cartilage thinning, reduced synovial fluid, reduced vascularity to surrounding tissues, all make knees more vulnerable. When these risk factors accumulate, your knees lose resilience, and safe movement becomes harder. Diseases, conditions that can arise if knee health is neglected, or you persist in unsafe loading. Various pathologies or chronic conditions may develop. Osteoarthritis, knee OA, breakdown of cartilage, bone-on-bone friction, pain, swelling, meniscal tears, degeneration, requiring surgical or non-surgical treatment, ligament injuries, e.g. ACL, MCL, often from stress overload or misalignment, patellofemoral pain syndrome, runner's knee, pain around kneecap, often from tracking issues, tendinitis, tendinopathy, e.g. patellar tendon, quadriceps tendon, pes anserine bursitis, inflammatory conditions, irritation of bursae around the joint effusion, swelling, synovitis, inflammation inside the joint capsule, reduced mobility, gait changes, compensatory injury, hip, back, ankle strain, chronic pain and functional decline, limiting daily tasks, exercise, quality of life. These conditions often feed back into one another. Pain leads to reduced movement, which accelerates weakness, which worsens mechanics, and further damages the knee. Listen to your body. Common warning signs that your knee health is being compromised: persistent or recurring knee pain, front, side, behind, during movement, swelling, stiffness, or joint tightness, especially in the morning or after rest, pain with ascending, descending stairs or rising from sitting, crepitus, grinding, cracking, or popping in the knee, sensation of instability or giving way, reduced range of motion, difficulty fully bending or straightening, pain around the patella, kneecap, during squats, lunges, or knee flexion, muscle weakness, especially quads, glutes, hamstrings, compensatory movement, hip or foot changes, limping, altered gait, gradual loss of mobility, reluctance to load or use the leg fully. If you notice one or multiple of these persistently, it's time to take preventive or remedial action. Safest exercises for knees. Recommendations and guidelines when choosing knee-safe exercises. The guiding principles are: minimize shear, compressive stress on vulnerable tissues, favor controlled, slow, and loaded or body weight resistances, strengthen surrounding muscles to stabilize knee, focus on proper alignment, good technique, and mobility, balance progress gradually, not jumping to high intensity or heavy load too soon. Below is a set of exercises widely regarded as safer or knee-friendly, along with tips and precautions. Always adapt to your condition, pain tolerance, and medical guidance. 1. Straight leg raises, quadriceps activation without knee bend. Lie flat, one leg bent, the other straight, tighten the quad, lift the straight leg a few inches off the ground, pause, control down reps, 10 to 15, 2 to 3 sets. Benefits: loads quad muscle without compressive knee bending. 2. Isometric quad hold, quad set seated or supine, press the back of the knee into the floor, contracting the quad, hold for 5 to 10 seconds, recover, repeat. This activates the quadriceps with minimal joint movement. 3. Glute bridges, hip thrusts, with knee alignment focus, lie supine, feet flat, knees bent, engage glutes plus hamstrings to lift hips, ensure knees don't collapse inward. Keep knees tracking over toes, this strengthens posterior chain and improves hip-knee synergy. 4. Clamshells, side-lying hip abduction, lie on side, knees bent or straight, raise top leg outward, hip abduction. Strengthens hip abductors, glute medius, which stabilize knee alignment in movement. 5. Seated hamstring curls, band hamstring work sitting or prone, bend knees to curl, possibly with light resistance or band, avoid jerky motion, keep control. 6. Step-ups, low height, controlled, use a low box or step, 4 to 6 in, 10 to 15 centimeters. Step up with good alignment, drive through heel, bring other foot up, step down, focus on knee tracking forward, not inward. 7. Partial, box squats, moderate depth, controlled, using a box or bench to limit depth, keep knees in line with toes, avoid knee collapsing inward, progress slowly, monitor pain or discomfort. 8. Reverse lunges, split squats, controlled, forward lunge pattern, step back rather than forward, lower slowly, avoid deep lunges initially, limit range of motion, keep front knee stable and aligned. 9. Calf raises, heel raises, strengthen calves, supporting lower leg stability. Stand on flat surface or slight step, raise onto toes, lower with control. 10. Balance, proprioception drills, single leg balance, unstable surfaces, eyes closed, small movements, improves neuromuscular control around the knee. 11. Mobility, flexibility, joint glide work, gentle knee flexion, extension, mobility, patella glides, hip flexor, hamstring, calf, IT band stretching. Precautions, tips: always warm up before loading knees, avoid sudden or ballistic movements without prior adaptation, use pain as a guiding signal, mild discomfort may be tolerable, but sharp pain or swelling indicates something is wrong. Modify load, body weight, right pointing arrow, light resistance, right pointing arrow, higher load, slowly focus on alignment, knees track over toes, avoid collapse inward, valgus, use tools, resistance bands, mini bands, boxers, slow tempo. These exercises aim to build a stronger, more stable knee environment before attempting heavier or more complex movements. If knee discomfort or warning signs are present, here are remedial steps: reduce or modify load, back off deep squats, Plyometrics. Heavy knee bending exercises temporarily add supportive activation and mobility work. More glute, hip, quad and hamstring activation. Mobility drills, soft tissue, foam rolling, myofascial release. Release tight hamstrings, quads, calves. IT band. Use joint-friendly modalities. Contrast therapy, ice, heat, compression, anti-inflammatory strategies. Diet, sleep, physical therapy, rehab. A professional can assess structural issues, alignment, muscle imbalances, and give tailored progressions, bracing or kinesio tape, if advised, in specific cases, to manage load while healing. Regular assessment and progression, monitor improvement, reintroduce load gradually. Medical evaluation, imaging or specialist consult if structural damage suspected, meniscal tear, ligament injury. Prevention, self-care plan to support knee health long-term. Integrate a holistic maintenance plan. Daily, around movement, warm up joints before movement, light mobilities, body weight movement. Frequent breaks if sedentary. Stand, walk, squat, shift stance. Step into safe knee exercises before heavier loading. Use proper footwear and surfaces. Avoid hard, unyielding ground. Weekly strength training for quadriceps, glutes, hamstrings, calves. Mobility and flexibility sessions, hips, ankles, quads, hamstrings, soft tissue work, foam roll, massage, low impact cardio, cycling, swimming, walking, to promote circulation without heavy knee load. Monthly, quarterly movement assessments, knee tracking, hip mobility, ankle dorsiflexion. Reassess exercise tolerance and progress deloads or light weeks to let joints recover. Health screening. Inflammation markers, vitamin D, joint health labs. By treating knee-safe exercise as part of your systemic health approach, you reduce risk while building resilience. Ancient movement traditions, yoga, martial arts, dance often included slow joint movements and progressive loading, preserving joint health over decades. Early physical therapy and orthopedic rehab. From the mid-20th century onward, therapeutic exercises for knee rehab, straight leg raise, isometrics, have been standard tools. Biomechanics and sports science. Modern research has clarified how shear, compressive, and torsional forces affect cartilage, meniscus and soft tissues. This has refined, safe, loading strategies. Osteoarthritis research. Longitudinal studies show that moderate, consistent loading preserves cartilage better than inactivity. Neuromuscular training studies, incorporating balance, proprioception, hip control, and glute activation reduces knee injury risk in athletes. Thus, the concept of knee-safe exercise is rooted in centuries of movement wisdom, refined through biomechanical and clinical research. If you ignore knee warning signs or continue unsafe loading indefinitely, the possible long-term consequences include progression of osteoarthritis, cartilage erosion, bone spurs, recurrent meniscal tears or enlarging tear requiring surgery, ligament degeneration or repeated injuries, ACL, MCL, chronic pain, swelling, joint stiffness, compensatory issues, hip, ankle, back pain, altered gait, loss of functional mobility, difficulty walking stairs, climbing, squatting, drop in physical activity, weight gain, metabolic health decline, psychological effects, frustration, fear of movement, reduced quality of life. Simply ignoring small pain often leads to structural issues that are harder, sometimes impossible, to fully reverse. Your knees are not disposable. They deserve careful attention, smart programming, and consistent maintenance. Choosing the safest exercises for knees isn't about avoiding all stress. It's about applying the right stress, in the right way, in the right dose, to build resilience, not breakdown. Begin with gentle quad activation, mobility, hip glute support, and low-impact load. As strength, control, and tolerance improve, you can gradually layer in more complex, heavier movement, but always with respect for alignment, pain signals, and recovery. Over time, Smart knee-friendly movement supports a life of mobility, confidence, and resilience. Don't wait until pain forces a change. Start protecting your knees today. Your future self will thank you for every safe rep, every careful progression, and every moment you chose resilience over risk. This article is for educational and informational use only and does not replace professional medical advice. If you have or suspect knee injury, structural damage, or serious conditions, consult a qualified healthcare provider, physical therapist, or orthopedic specialist before beginning any exercise program.